Hello, this is Steve from White Horse Yoga. Today I want to talk about the arm or the upper limb. The upper limb, of course, includes our hand, our forearms, our arm. It also includes our scapula and our clavicle. Now, the only part of our arm that is actually attached to our axial skeleton is going to be this end of our clavicle. This is where it attaches pretty firmly to the sternum or our breastbone. Our collarbone, otherwise, is the only place where we're attached. So this whole extremity is just kind of hanging loose. Now, that means that it's a very mobile joint. We can do a lot of things with this joint, move it in all kinds of directions, about every direction you can possibly move. The other thing that makes that significant is it's unstable. So even though it's mobile, it's unstable because that's where the only attachment point. The scapula sits on our back around our rib cage and actually is enclosed by soft tissue. So there's no kind of attachment here as far as a bony attachment. I want to look just momentarily at this joint again. Here is our clavicle and our sternum, and you can see the sternoclavicular ligament where our sternum is attached. If we turn this around just a bit, you'll see that the arm and the scapula really are not an attachment. So I have to turn it a bit, but you can kind of get a feel how that scapula just kind of rides on the back of the rib cage. There's not another bony attachment. A couple of things I want you to know about. One, our collarbone or our clavicle is our most frequently broken bone because, again, it's got this whole weight attached to it and it's only attached right here. The other thing is there is a muscle that comes out, and you've heard about rotator cuff muscles. One of the rotator cuff muscles, this is the spinous process of our scapula. So our scapula, here's our spinous process. Above this is supraspinatus, which is one of our rotator cuff muscles. That muscle goes through here and then goes through this teeny tiny hole to attach to our humerus. So our humerus or our main arm bone. Now I'm going to switch here and show you a different view. So here's our scapula. Here's the spinous process. Here's a muscle coming out here. You can see with this muscle, hopefully you can see, every time I move my arm, that muscle can come up here and impinge on this part of our scapula that rides above it. Every time you lift your arm, if you have any kind of problem with your shoulder, it will pinch and pinch and pinch and eventually maybe cause a rupture of that rotator cuff muscle that we call the supraspinatus. So it's very important for us in yoga to make sure we have good alignment of our shoulder, that we pull our shoulder down and away from this part of our scapula that can cause impingement. So that's our second point. So as we lift our arm repeatedly, we can impinge and maybe even rupture and tear that supraspinatus. We have our scapula, clavicle, humerus, upper arm bone. Our forearm is made up of the ulna, which is the bone that comes up here and makes up our elbow, and the radius, which is on the thumb side of our forearm. And then we have our carpals, metacarpals, phalanges. Okay, want to go back and talk about the carpals. You've heard about carpal tunnel syndrome. What carpal tunnel is we have a band of connective tissue, elastic tissue that wraps around this wrist to keep it stable. As you can see from this picture, there are a lot of ligaments that run up and down through the wrist into the hand. And then right here is that carpal tunnel that we talked about. It's that elastic tissue that is just forms a band, kind of like a tight rubber band around the wrist to keep everything stable. Somewhat like, well, I tried to demonstrate it here with tape. But that band of tissue is pretty hard. As we keep moving and doing repetitive things with our wrist, that can cause some impingement again and some inflammation in this carpal tunnel and the nerves that run through that carpal tunnel. It's a very narrow area, and so the nerves can eventually start to become inflamed and impinge. That's when people start having what's called carpal tunnel. Now, in yoga, we do lots of wrist mobility movements trying to prevent that carpal tunnel syndrome. We also put a lot of weight on our wrist in downward facing dog, in various planks and push-up positions. So we have to be cognizant of this area because it's a very delicate area and we can cause injuries there. The main places we're going to cause injury are going to be our joints. So we cause injury at our wrist by doing things incorrectly or repetitive movements. We can also cause some injury at our elbow. We can also very definitely cause injury at our shoulder, particularly with chaturanga and some other movements that we do in yoga. So those are the areas that we need to be aware of the upper arm and how they pertain to yoga. So what I would like you to remember out of this video, one, the name of the arm bone. Know that the attachment is only at one point, so that means we have a very mobile joint. We also have a very unstable joint that is prone to injury. The clavicle is our most frequently broken bone. We can have some impingement because every time we lift up our arm, we impinge the muscles that run through that little bitty hole made by the top of the scapula. And so that could eventually lead to injuries if we do things incorrectly, sometimes even if we do things correctly, if we have, depending on the alignment of our joints. And then carpal tunnel, which is one of the reasons we do so many wrist exercises in yoga.